Hi, my name is Marcelo Evangelista. I am the practice owner of EV Dog and Cat Clinic. Today, I'm going to share a short video, part of the 3 video series about cranial cruciate disease in dogs. This video has 3 main parts. First part is understanding of the cranial cruciate. So here, in this particular video, I'm going to eliminate some confusions. Kasi maraming pet owners ang nagdadala ng pets or dogs nila sa veterinary clinic just because of lameness. Okay? That's the most common complaint among dogs. Ngayon, marami ang nakukonfuse due to terminology na ginagamit natin sa veterinary as compared to human. Because human terminology when it comes to the knee or when it comes to the anatomy are the most common and widely used. Even in veterinary, the main goal of this video, the first part, is to eliminate this confusion and to give you some information about cranial cruciate disease. Okay, bakit nga ba dinadala sa veterinary clinic yung dog? Diba? Mostly ay dahil sa hindi makalakad, hindi makatayo, hindi makatalon, hindi makaakyat, no? So, majority, according to the reports, majority ng mga lameness occur in the pelvic limb. Okay, pelvic limb, yung hind legs. Okay? Then, stifle injury, no? Which is the knee, accounts majority of these conditions, presented conditions in veterinary. Then, the 2 most common stifle disease or injury is cranial cruciate and patellar luxations. No? Second to hip dysplasia. So, all in all, there are 3 most common orthopedic conditions in the pelvic limbs. From the hip, we have hip dysplasia, the knee, patellar luxations, and the cranial cruciate disease. Para nga po hindi tayo nalilito for pet owners doon sa mga terminology na naririnig niyo sa vets nyo, kasi magkaiba ang terminology ng when it comes to anatomical directions, parts ng knee or ng parts of the body, magkaiba po dun sa human. Okay. When it comes to cranial cruciate, the term cranial cruciate is synonymous to ECL in human. ECL, anterior cruciate. Kasi po, in topographic anatomy ng human versus dogs, ang human po, yung harap, tatawag natin dyan is anterior, posterior sa likod. But in dog, yung harap towards the head is cranial. And towards the back or towards the tail is caudal. Kaya tinawag na cranial cruciate. Sa human naman is anterior cruciate. But it's similar structures. Okay? Then, stifle is another terminology na ginagamit din sa veterinary. Exclusively used for animals, dogs, and cats. Sa human, we call it knee, yung tuhod. In dogs, we call it stifle. Okay. Para po ma-eliminate natin, ma-avoid natin yung confusions when you are going to visit your vet, alam nyo na yung mga differences na yon. Okay? Stifle is similar to knee. Cranial cruciate is similar to ACL. Ang anatomy, basic anatomy po ng knee, there are 3 bones here. Femur, yung thigh bone, sa taas, that's connected to the hip. And down, distal, connected to the knee. Okay? The femur, the patella, the biggest sesamoid bone, to yung kneecap. Then, the tibia or shin bone. There's a smaller bone here, which is the fibula. Okay? Then, there's a strong tendon. I call it tendon instead of ligament. If it's ligament, I think bone to bone. But tendon, I think appropriate is tendon kasi bone to muscle, which is the quadriceps muscle. Ito yung cranial muscle sa tayo. Ang focus natin is cranial cruciate. So inside the joint, is encapsulated by the joint capsule, meron doon dalawang ligament, which is the cranial cruciate and the caudal cruciate. No? Hindi na natin gagamitin yung term na anterior cruciate. Instead, cranial cruciate na tayo. Okay? Cranial cruciate, there are 4 linkages inside the joint. Okay? Yung cranial cruciate, caudally is attached to the caudal condyle of the femur, and then it crosses distally towards the cranial aspect of the tibial plateau. The caudal cruciate naman is from the caudal aspect, cranial aspect of the condyle towards the caudal aspect of the tibial plateau. So it's like a cross. If it's the cranial cruciate from the caudal aspect of the femoral condyle towards the cranial of the tibial plateau, and then the caudal cruciate naman is from the cranial condyle of the femur towards the caudal of the tibial plateau. So nagko-cross sila. That's why it's called cruciate. Then on top of the tibia here, the proximal tibia, the tibial plateau, meron siyang meniscus. Yung para siyang cushion, a structure that serve as shock absorber. So sometimes nadadamage po yan once nagkaroon ng instability yung knee due to cranial cruciate disease. And please take note that hindi lang po ang cranial cruciate ang nadadamage when there is a cranial cruciate disease or rupture or torn ligaments na apektuhan yung other structures. Pwedeng mag-trigger doon sa kanyang hip. Nagkakaroon ng hip dysplasia or vice versa. Pwedeng hip dysplasia due to instability of the hip, pwedeng magkaroon ng problema sa knee. Then, the function. Ano pong function ng cranial cruciate? Okay, ito yung femur, tibia, the knee. Inside the knee capsule or the joint capsule are the cranial cruciate and the caudal cruciate and the meniscus. So, ang number 1 function ng cranial cruciate is to prevent hyperextension. Ano yung hyperextension? If this is the flex position of the knee, this way. So pag nagkaroon ng hyperextension, extended. To prevent too much extension. Another function of cranial cruciate is to prevent internal rotation of the knee. This is the left knee. So internal rotation meaning yung tibia is moving inwards towards the side, towards the middle. Inward or internal rotation. Piniprevent din yan ng cranial cruciate. The last one, but not the least, the cranial translation of the tibia here. So, magtataka kayo bakit during physical examination, dinala niyo yung dog nyo suspected of cranial cruciate disease or knee problem or any lameness, no? The vet might consider taking some examination on the knee, no? Titingnan kung may yung drawer sign. Ano yung drawer sign? Pag mayroong instability yung knee due to rupture of the ligaments, the cranial cruciate, hindi na stable yan. Yung may movement yan. That is drawer sign. Back tayo sa ating full video. So, pag may drawer sign na po, this is the knee, no? Hahawakan namin yan. Then, ipupush yung tibia towards the head, cranial. No? Ipupush namin yan. Kung mayroon na siyang cranial cruciate disease or rupture, magmumove yan. Magkakaroon ng drawer sign. So, yun ang mga function na piniprevent ng cranial cruciate. Hyperextension of the knee, internal rotation of the tibia, and the cranial translation or drawer sign of the tibia. Okay, here there is a difference between human and animal. As I've mentioned, that difference in anatomical or topographic anatomy in dogs and human is very pronounced. Ano? Makikita nyo, ang dog in a standing position, naka 135 degrees yung kanyang angle ng knee. But in human, about 180 degrees. Ang human is straight, 180 degrees. But in dog, it's about 135 degrees. What's inside the knee? Again, the knee joint, the cranial cruciate, the caudal cruciate, and the meniscus. So, what are the causes of cranial cruciate disease? Although this is still unknown, but trauma is uncommon. Okay? Unlike in human, trauma is one of the most common cause of ACL or torn ACL. Mga athletes, no? Kasi pag sumisipa sila, ganun, yung hyperextension cause rupture, acute rupture of the ACL. But in dogs, trauma is uncommon. Maybe a degenerative condition, biomechanical, and that develops over time. Minsan nagkakaroon muna ng partial tear, then progresses to a complete tear of the cranial cruciate. So it will be very painful and cause inflammations, ano? Nagkakaroon ng buttress sign. I-discuss natin yan sa next video series, no? Part 2 of the series. Then nagkakaroon ng meniscus injury, no? Na-mention ko kanina yung meniscus, yung nag-serve as cushion doon sa kanyang knee, no? So once nagkaroon na torn ligaments, fractured cranial cruciate, the friction and the rubbing of the condyle towards the plateau can cause damage to the meniscus, especially the caudal meniscus. Then, kakaroon na ng osteoarthritis due to inflammations, no? Reaction to pain, which is irreversible condition. That's the topic for today, and hoping that we can still be able to share the part 2 and the part 3. The part 2 will include the diagnosis of cranial cruciate disease, and part 3 is how we manage surgically cranial cruciate disease. Thank you. Thank you so much for watching.